Hi, my name is Kenna Guenther, and I'm working with Gabby Hagen and Helena Kurschner. This is an evidence-based review for NU 307 under Professor Stephanie Burkholder as a part of the Carroll College Nursing Department. Our SURF presentation is entitled An Analysis of the Contrast Between Male and Female Concussion Symptom Severity and Resolution. We will be examining and analyzing differences between male and female concussion symptom resolution, and we have 6 articles to discuss with you guys today, and we are excited you are here.
Our question of interest for our research was, following a concussion, how do females compare to males in the resolution of their symptoms? We were interested in this question because we believe that it is pertinent to all populations. So everybody knows somebody that has had a concussion, so we figured that this would be important for anyone that was willing to read it.
So to give you guys a little bit of background, a concussion is a complex pathophysiological process affecting the brain induced by traumatic biomechanical forces secondary to direct or indirect forces to the head. Concussions can cause both functional short-term and long-term changes affecting tactile sensation, cognitive processing, language, and emotions. While most concussions resolve themselves within an average of 10 days, some symptoms can last for weeks to months after injury and can lead to complications such as post-concussion syndrome, post-traumatic headaches, and post-traumatic vertigo.
As Gabby mentioned, we chose this topic because it applies to essentially every population in every healthcare setting. So as nurses who want to work, we all want to work in very different areas. This concussion, male and female differentiation of symptoms is very applicable in our practice. Furthermore, all 3 of us have at some point sustained a concussion in our lives. For me personally, it was kind of a turning point, and it really took a toll on my quality of life. So I have always been passionate about concussion symptoms, prevention, and education. So in order to find high-quality articles and research for our systematic review, we had several search criteria we put into place. All of our articles are 5 years or younger within publication to adhere to the newest and best research, as well as the qualifications for this class. So we have a couple articles from 2016, and the rest are from 2019 and 2020, meaning that all of our research is the newest, which is good. All of our articles were also originally published in English. They also had to specifically discuss male and female participants in the research, and they had to be ranked above a level 6 in the levels of evidence. To find our articles, we used several sources. The main one was CINAHL, which is the Cumulative Index of Nursing Health Allied Literature. It's a very, very reliable source that we get here at Carroll. To find our concussion symptomatology and information on things like that, we use the Mayo Clinic and the Centers for Disease Control. The first article that we looked at was called The Influence of Test Environment, Age, Sex, and Sport on Baseline Computerized Neurocognitive Test Performance, and was written by French et al. In 2019. You're probably wondering why the title of this article includes all of these criteria and isn't really specific to our PICO question, but because this is such a new topic of study, we had to use articles that discuss several factors of concussions, and they did specifically mention sex. So this was actually a very good article to reference. It is a level 4 cohort study, and it was the main goal of the article was to identify if there was a difference between the group and the individual testing environment on a post-concussion assessment test. But they also looked at a variety of factors, like they said, sex, age, and their baseline. So the results concluded that there were no measurable differences in cognitive functioning between the group and individual setting, but there are differences among sex, age, and sport type. So this article by French et al. Discussed how females are more likely to report symptoms overall and have symptom severity lasting for a longer amount than males. The second article I talked about was Concussion Incidence and Recovery in Swedish Elite Soccer, Prolonged Recovery in Female Players. This article specifically pointed out that females are far more likely to have to be forced into retirement off of a concussion injury, and they typically have symptoms lasting 3 months or longer, while males have symptoms lasting about half that long. The article also highlighted that females have more severe symptoms and, again, that longer recovery time regardless of if they take time off from their sport. So this was looking at soccer players in particular, and this article concluded that there was no measurable statistical difference between male and female recovery, the research strongly suggested the difference in recovery.
The third article we examined was entitled Gender Differences in Recovery from Sports-Related Concussion in Adolescence. This was a study of 147 student athletes ages 13 to 19 who had sustained a concussion during a sport that was observed by a team doc or an athletic trainer. This was a very important study in our research because it was one that required the patient to be followed from point of injury to point of return to baseline. So this had really great information for us to use in comparison between males and females. It found that women were taking, again, longer to recover from their injury. They also were more likely to sustain a greater force of secondary impact, so like the whiplash of their concussion, the secondary impact when their head went back was a greater impact than that of their male counterparts due to their decreased head and neck segment mass, which was very interesting to learn about. Our fourth article was titled Lifetime Prevalence of Concussion Among Canadian Ice Hockey Players Ages 10 to 24. This was a larger study with 5,223 participants, but it was not based strictly on sex, so it did have a little different scope than the third study. One of the more interesting things to see in this was that sex had the second greatest disparities. So, behind age, younger people recover from concussions faster, but the next greatest difference was that men were consistently recovering from their concussions earlier, they were reporting lower mean number of symptoms, and their symptom severity scores were also lower.
The fifth article that we found was called Academic Dysfunction After Concussion Among U.S. High School and College Students. The purpose of this study was to identify whether concussed students had a greater academic dysfunction than those who sustained other injuries and whether gender, age, concussion history had a significant impact on the outcomes of this study. The results revealed that a higher percentage of females than male concussion clinic patients received academic adjustments, suggesting that females and individuals who have had a history of two or more past concussions are at greater risk for exacerbated symptoms and longer recovery periods. The final article that we found was called The Relationship Between Symptom Burden and Systemic Inflammation Differs Between Male and Female Athletes Following a Concussion. So the purpose of this study, it was to determine whether symptom severity had direct correlation with the inflammation in males and females following a sports-related concussion. And the study concluded that there was significant difference between males and females in the severity of symptoms and the presence of systemic inflammation. They found an overall relationship between symptom severity and inflammation that was more generalized in females than males. So after examining all these different articles, the research suggests that females have a longer recovery period compared to males following a concussion. However, our personal PICO question still remains unanswered due to the lack of statistical evidence. But it is hypothesized that females take longer to recover in terms of returning to academic performance, neurocognitive functioning, and a baseline physical capabilities compared to males.
Well, our results are technically inconclusive concerning our personal PICO question. This research and data is still remarkably pertinent to the nursing practice. Probably the biggest way it is pertinent is that nurses need to understand these differences between males and females in order to gather appropriate assessment data and help to make that diagnosis that can treat the concussion. So by recognizing that males are less likely to report symptoms and partake in rest periods, nurses can learn how to ask the right questions to get males to admit they're having symptoms such as nausea, vomiting, if they passed out, examples like that. Concussions are also relevant to essentially every area of nursing, whether it be school nursing, ER nursing, clinical nursing, the list goes on and on. So every nurse is obligated to know all they can about concussions, as they are, again, an extremely common injury. Furthermore, nurses can also take part in further research studies. We talked about how this data is relatively new. Well, this is a field that could potentially grow and make a lot of progress in this research. There are obviously some differences between male and female concussion resolution, and people in the healthcare setting need to know more. Nurses are in a unique position that they are taught how to assess every body system and how to look at the patient as a whole. So if nurses would like to be involved in research and be that person to create a study that looks at every aspect of a person, we could potentially come up with great results that could change the way that we diagnose and look at concussions across ages and sexes. In conclusion, we looked at male and female differences from concussion resolution. We had a great time researching this topic. There's a lot of research out there, but there is still progress to be made. Concussions are extremely prevalent in the United States and the world across every demographic, so it is extremely important that nurses are educated and know how to assess, treat, diagnose, etc., educate patients on concussion symptoms. So thank you so much for listening to our SURF presentation.